In part 2 of our dysfunctions lecture, we will explore sleep disorders. Sleep disorders are distinguished from sleep disturbances in that disorders markedly interfere with normal sleep, cause significant impairment in daytime function, and/or result in self-inflicted bodily injury that requires medical treatment or would result in injury if preventative measures were not taken. Thus, sleep disorders are, generally speaking, more severe than sleep disturbances. There are over 100 sleep disorders documented to date. But for purposes of this class, we will explore 10 of the most common ones. You might recall that typical non-clinical sleep labs have EEGs, EOGs, and EMGs. A typical clinical sleep lab, used for identifying and treating sleep problems and disorders, has additional equipment to measure bodily functions, such as nasal devices and/or masks to measure oxygen intake and breathing patterns, EKGs to measure heart rate and rhythm, additional EMG electrodes to measure leg movements, etc. Staff generally consists of clinicians and researchers. These are usually psychologists and psychobiologists with PhDs, and MDs who specialize in sleep medicine. MDs on staff may include pulmonary physicians, neurologists, psychiatrists, internists, etc. Finally, sleep technologists. This position usually has the equivalent of a master's degree. Sleep technologists have training in polysomnography and other sleep equipment. The entire staff generally meets regularly to discuss specific case studies, and this is often called grand rounds in the field of sleep medicine, grand rounds. So, number 1, obstructive sleep apnea. There are different types of sleep apnea and sleep disordered breathing problems, but the most common by far is obstructive sleep apnea, a prevalent disorder which involves periodic pauses in breathing that can last from a few seconds to minutes. Typically, normal breathing then starts again, often with a loud snort or gasp. These intermittent breathing pauses may occur 30 times or more in an hour, and breathing periods are often, but not always, accompanied by loud snoring. 1 out of 4 adult men have this prevalent disorder. Only 1 of 10 women do until women are postmenopausal, after which their prevalence matches that of males. Obstructive sleep apnea is quite rare in children. Obstructive sleep apnea occurs because the throat is constricted shut during sleep. The chest is moving, trying to inflate the lungs, but air cannot get through the throat. Snoring frequently accompanies breathing periods because the throat does not completely open back up, causing the throat tissue to vibrate as the air is forced through the narrow passage. Many but not all sufferers are overweight and have thick necks. Sleep apnea is often accompanied by high blood pressure and various heart problems, especially arrhythmias, and gets progressively worse with time. Alcohol, antihistamines, tranquilizers, opioids, sleeping pills, and muscle relaxants make symptoms worse, as does sleeping on the back. Sleep apnea severely decreases quality of sleep. Thus, sufferers often awaken disoriented and foggy-headed. Because of excessive sleepiness, they can easily become depressed, irritated, hostile, and diminish sexual desires. Most also complain of concentration, judgment, and memory problems. Thus, they frequently have a history of divorce, employment problems, and experience a high rate of car accidents. Continuous positive airway pressure. This is oftentimes referred to as CPAP, all caps, CPAP. Continuous positive airway pressure in the form of a breathing mask or one of its more recent variations has become the most commonly prescribed treatment of sleep apnea. Next is lifestyle changes such as losing weight, sleeping with a tennis ball sewn into the back of pajamas to avoid sleeping on the back, and avoiding the many exacerbating substances listed earlier. In a recent study, Carley and his colleagues have shown a synthetic form of cannabis to be effective in treating sleep apnea. Surgery, such as enlargement of the throat, is a last resort for adults, and often removal of the tonsils and adenoids corrects sleep apnea in children.